Dr. Jones, lots of people, at least I do, sometimes we're a little confused about veneer and lumineer. What is the difference there? To me, they all clip-on fingernails, clip-on tooth nails, I guess. But tell us what's the difference. Is that something us patients need to worry about it at all in terms of the difference?
Well, yeah, certainly that Lumineer has been advertised a lot to the public, and Lumineer is a term that's been coined by the Denmet company to indicate a very, very thin porcelain veneer. And to be quite honest with you, Helmut, thin porcelain veneers have been around a very, very long time, but it was the Denmat company who actually coined the phrase Lumineer. And good for them, because they've got people talking about what could be possible with dentistry. And whether you choose to use the actual Denmat product as a Lumineer, or you choose to use a different thin porcelain veneer, the end result is the satisfaction for the patient and how beautiful their smile can be.
So both a Lumineer or a veneer do the same thing. They kind of like make the tooth from the outside looking the way you, in combination with the dentist, want to look it.
A Lumineer is a veneer.
Okay.
A Lumineer is a veneer, yes.
So
it's just a generic term.
What is the advantage of a very, very thin veneer, if there is an advantage?
Sure.
There must be one, otherwise a large company wouldn't make such a dada out of making it.
Yeah. Well, it's very careful to go through the pros and cons of any dental procedure with the patient, but certainly with Lumineers. Lumineer is not the right choice for some patients. So the selection of the patient is very, very important. But the advantage is that very little, maybe no, tooth structure has to be removed at all. So when they say no drilling, you use the term the clip-on nails. And in reality, that's exactly what it is. It's a very thin, very strong procedure that can be done with no removal of any of your own tooth structure, no drilling on your teeth at all. And that's what the Lumineer has brought to the table. And we can do that with any kind of porcelain, but the term Lumineer essentially means very thin, minimal to no tooth preparation at all.
I see. So you don't need to grind the tooth down, which some people and most of you dentists agree. If you don't have to do it, don't do it. Because it's like in the old days, my father would yell at me when I put my knife to a tree and carved my name in it or something like that. He would say, come on, you no matter what, you're hurting that tree. And a similar way, once you grind a tooth, there is the potential that it gets a shock, and then down the road, a year, two, whatever, because of it, so to say, the root starts dying, and then the tooth needs to be replaced.
Well,
not.
I wouldn't go that far. I think that the reason is just if you don't have to remove your own natural enamel, then don't do it. We're not trying to avoid potential problems, because there are lots of times when people have a lot of their dental enamel removed, but it's necessary, and these problems that you just mentioned don't happen then. So it's not to avoid those problems, it's just if you don't have to, don't do it. Keep what's natural, and add to it where you need to add to it. But if you don't have to remove enamel, then just plain don't do it.
Yeah. Even though you actually cover that enamel and it's never seen anymore because the veneer goes over it.
Right.
Okay. But anyway, I'm sure lots of people, including me, I assume if that would happen, if I qualify for a very thin veneer and the doctor tells me we don't need to grind it down, I probably say, that's good. Not because of that I want to keep the enamel, simply because I don't want to have that little grinder around my tooth.
Right.
I mean, in itself. Right. Probably that means it can be done without an injection in many cases if you don't need to grind, right?
Yes.
So that must be some advantages, but that's basically it. And so let me, just a little bit of like Lumineers and veneers most people think that they're used for, teeth which are very bad looking, chipped, and etc., which is obviously true. Teeth which are too small or stuff like that, or for that much too big. You grind them and you put a nice, veneer over it and make them again the way you want them. You match colors, but also sometimes people who, let's say, have a couple, 2, 3 crooked teeth in their mouth, they don't want to wear braces or Invisaligns for whatever it is, a half a year, 2 years. Sometimes they have their teeth grinded, readjusted, and boom, you put that Lumineer veneer on it and make it good looking overnight rather than over a year's time. Is that correct? Is that a use for Lumineers and veneers also?
Yes, they call that instant. Yes, they call that instant orthodontics.
Okay.
And instant orthodontics is where you do just that. You might reshape them just slightly, trim them here or there, and have some Lumineers or some thin veneers made, and within a very short time can put those in place, and it looks like they've had braces for 2 years, and their teeth come out beautiful. But changing the colors of the teeth, often darker teeth or more yellow teeth, can be lightened with Lumineers or veneers. Teeth that are too small or you have big gaps in between your teeth can be enhanced with Lumineers. The spaces can be closed. Chip teeth. Often, someone will have an accident and chip a tooth, and the filling material gets yellow or dark. Or if somebody unfortunately has had to have a root canal and they've had a dark tooth, lots of reasons why a tooth might have darkened, and those can all be enhanced. The colors of those teeth can be enhanced with Lumineers or veneers. Absolutely.
Yeah. Well, you could get a chipped tooth not wearing a snoring device and snoring, and your wife kind of punching you and say, you snore again, and then next thing you know is you have a chipped tooth.
That's possible.
Yeah, it's all possible. Well, thanks to enlighten us here about Lumineer and veneer. Really, for all purpose, the same. And I guess as patients, we really shouldn't have to worry too much. The dentist will make the decision which one is more appropriate for the particular situation. Is that correct assumption?
Absolutely. And it's always good to ask. And again, it goes to risk and benefits. And if the benefit for veneers or Lumineers are what is the best for you, then that's exactly the road that you should go. And if there's another treatment choice that's better, then that's the choice that should be made. But you bet. Just whatever's healthiest for you in the end is what we should decide.
Thank you very much again.